Okay, we're at 9:02, and I think we'll go ahead and get started. We have a few more people that are entering the room. So I'll go ahead and get us started, and the recording is on. Okay. So thank you everyone for joining the NEMSIS V3 implementation call. Today is Wednesday, March 26th of 2025. We really appreciate you being here today. I'll go ahead and get us started by saying if you have not already done so, please go ahead and update your name with your affiliation in the participation list. We ask you to do this, especially if you're a software vendor, so that we can ensure that you get the proper credit for attendance on this call as per the compliance policy. I would also like you to know that these meetings are recorded. And so if you need to jump off or if you want to share this call with someone later, please feel free to do that. These calls will be available on the NEMSIS website as well as the YouTube channel. And we do encourage your participation. So you're welcome to come off mute or to use the chat feature to enter any questions or any comments. We will also review the chat during our post-meeting debrief to ensure that we are aware of any action items related to your comments. And now today we'll go ahead and get started with a stakeholder introduction from my colleague, John Britt.
Good morning. I hope everyone is well. I'm going to take over the screen for just a second. All right. So our stakeholder introduction today, the idea, why do we do them? Well, to get to know others on the call, build connections that lead to possible collaboration, possibly get ideas for new hobbies, spotlight someone for 30 to 45 seconds, and have fun. We always ask the same questions. What do you like to do to relax or unwind? This person likes to watch Star Wars or Mission Impossible movies. And to continue with the theme that I started last week of getting Copilot to come up or create images, I had it create an image combining Star Wars and Mission Impossible, and this was its first try. I didn't think it was actually all that bad. Interesting facts, he built a full-scale R2-D2, and I want to hear more about that. And I don't think that Copilot did as great of a job with these pictures, because neither of those look like R2-D2 to me. How long have you been in EMS or healthcare and data? 12 years. And it skipped a slide. Huh. So the other question is, what is something others don't know about you? And then this person worked as a tutor and as a guide at an amusement park. That's slide's not there for some reason. What do you like best about your job? It's been interesting to learn how data that is collected is being used. Any guesses? So it is my pleasure to welcome data manager for the Arkansas Department of Health section of EMS. And that looks like a full-size R2-D2 to me. It's two little doggies and his wife. So as always, I'll put a link in chat if you've not been introduced. And also, here's the QR code. You can do the form using your phone. It's quite easy. And then this is a picture from our last annual meeting. I'll update it after the annual meeting this year, which I'm sure we will talk about in a minute. And that's it. Thank you, Monet. Back to you.
Thank you, John. That was fantastic. And thank you so much, Derek Schultz, for sharing your pictures. We really appreciate that. Now we all know who you are, and we'll get a chance to meet you hopefully soon. Okay. According to the agenda, we were going to have Mr. Chaney speak at this time, but we will push this to another slot here, and I'll ask Dr. Mann to talk to us a little bit about the critical patch update.
Yeah, thank you, folks. Thank you for joining us this morning. Just going to give you a quick update in regards to the critical patch work that we've all been talking about and tracking. We are moving as expected in regards to the development of critical patch number 5 for 3.5.0 and critical patch number 1 for 3.5.1. Everything's going well. We announced that that would be released within the time window of April 3rd and April 17th. It looks like it'll be much closer to April 3rd. So we're excited about that. April 3rd is next week. So we'll either be released the end of next week or just a few days into the next following week. So we'll be happy to get that out. As a reminder, once those critical patches come out, all of our resources that have been associated with the data dictionary and kind of the XML XSDs that we provide, that will all come back up. So the Git repository will be back online. The data dictionaries will be back online. We'll work to get all those loaded back up onto the website as quickly as possible. So everything remains on track. Then once the critical patch, I'll just remind the software companies on the phone, once we have the critical patch up and ready for you to consume, there'll be a 3-month window where we're hoping that you'll be able to implement that, and we will put together and have prepared a very short compliance 2-hour from beginning to end 2-hour compliance testing process that we'd ask you all to go through. It will represent a single test case that has very minimal data in it. It shouldn't take very long at all to complete. That's included in the 2 hours. And then we'll do a quick Zoom authentication that the new elements are present in the GUI, in the user interface. So we'll provide more instructions regarding that process. We talked about that process. I'll stop there and just see if there are any lingering questions related to the critical patches that are coming out. All right. If you have any questions, feel free to post them in the chat, or if you'd like to reach out to me, feel free to call me or send me an email. Would be happy to work with you on any questions. Thank you, Monet.
Thank you. Okay, at this time, I'll ask Jen to get ready to present or to introduce the topic. We're going to have a discussion about the national validation rule.
Good morning, everyone. So one of the things that the NEMSIS tax started doing last year was inviting people to send in their any type of issue or question that they had regarding validation rules. And if something came up that needed to be discussed by the stakeholders, possibly consider revisioning, then we'll discuss them here on the V3 implementation calls. So in November of 2024, we had an agency reach out in regards to schematron rule E184. And if this will share, which I practiced. Hopefully you're all seeing a page out of the data dictionary. So the rule E184 is in regards to patient evaluation and care should be patient evaluated and care provided when crew disposition contains initiated primary care or provided care supporting primary EMS crew. And their question was when E disposition 28, and just really quick, remember E disposition 27 is the unit disposition, E disposition 28, patient evaluation care, E disposition 29 is the crew's disposition. So E disposition 27 was equal to patient contact made. Disposition 28, patient evaluation care, was equal to patient evaluated and care provided. And Disposition 29, which is the crew disposition, is provided care supporting primary EMS crew. And the question the agency had is, why should the supporting crew have to enter all of the patient demographics, the impressions, the symptoms, the history on their EPCR when the primary crew, when the agency in charge on scene is actually doing most of the patient care? They're actually just supporting the primary crew. So that is the question for this group to discuss, is E184, having the non-primary agency in charge, somebody who's just supporting another crew in patient care, should they be responsible for all of the same information that the primary care providers are? And this is the part where anyone should be able to unmute themselves and discuss kind of the pros and cons and the question and ask anything that they'd like clarified.
This is Lauren from Zoll. I think if they're able to be linked with other identifiers, I don't really see the need for duplicate documentation personally. Unless
Thank you, Lauren.
unless they're utilizing it for some sort agency specific, but.
So state data managers that are on the call, is there a use for that information on the supporting EPCR, having the patient demographics and that information repeated?
How about litigation? I mean, how do you know that that was the right patient if you can't even identify who the patient was? I mean, it closes the loops, HIE integrations, outcomes. I mean, it all ties back to that. If they want any of that, they got to have that as well. They got to have matching information. But I think biggest thing is litigation.
And that's a great point. Litigation is always something that should be considered.
Would it cause?
You know what? I just thought of one other thing too. You know the old adage, if you don't document, it didn't happen. Well, so the agency providing the primary care may not document something because the secondary did it or the helping crew did it. And so it leaves a hole. Like, who gave the aspirin? Well, they did, but you didn't document it, but I didn't do it. They did. So it kind of all ties it back together again. Sorry, didn't mean to interrupt you, Lauren.
No, that's okay. I was just wondering if there was other like identifiers that could link to EPCRs that wouldn't cause duplicate information to be sent, or the need for.
And this is Samantha with EHESO. It makes sense to me that they would have to include all the patient demographic information. I think what would be something to explore is, are they required to do all the patient care stuff like 3 sets of vitals and specific interventions, depending on the state? If that's where there could be that differentiation that says, I wasn't the initial and primary, but I did support. And I think it's important in that case to make sure you have patient care, but I think the rules for what you do change.
That's another good point. Eric Paulson from Napa County EMS asked the question, did the secondary crew make patient contact? That's a specific code, right? And yes, so the secondary crew does indicate in Disposition 27 that they have made patient contact. And then Amber Greger from First Due, what's their definition of a patient? This will likely differ between departments on when to collect this information. So from the NEMSIS perspective, the state establishes what the definition of a patient is within their state. And then I think if there's a state that does not, and Clay, feel free to jump in and correct anything I get wrong. If a state does not define a patient, then the agency or local RAC is able to define what a patient is.
Seems to me that it also depends a little bit on the exact nature of the response that you're charting. For example, if that if that supplementary crew is actually accounting for prior to arrival time from the primary crew, I can see why you would need that demographic information. But I have seen agencies where if it's like a dual response where one is there the whole time, just helping the other crew, like a QRV that arrives simultaneously, they have more of a tendency to fold that into one chart so you're not duplicate charting and just add them on as a crew for that call to the primary responding unit.
Yeah, but in that scenario, that is a single chart, so therefore everything is documented. It's when you have two separate agencies with two separate units on scene that it becomes an issue. And again, I in California especially, if you didn't document it, it didn't happen. And legal is, next to one of the higher considerations.
Yeah, in that situation, I've usually seen them do. I don't want to call it dual documentation because it's really the other crew documenting their piece of what they did, right? Even though the PTA interventions would be on the primary crew, I can see why you would need to clearly identify the patients and what you did.
We'll throw one more piece in there. What if there are each agency or there are two separate agencies using two different vendors? Now it's never going to get combined and or slash. What if they need it for billing? I mean, there's just so many things.
Frank Sloan from CARES says it comes down to what the assisting crew did. Handing the primary crew member a splint is pretty different than starting an IV on the patient or giving a drug for a bunch of reasons. So and this being a national rule, right, we can't get down to, well, if you did these procedures, then don't fire. If you didn't do these procedures, then don't fire, because that also changes from state to state. So from the national rule perspective, does anyone see a reason to change this national rule? That when you indicate that you are providing support to the primary patient care agency or crew, that you have the patient demographics and the information. And then if the states themselves want to adjust the rules that they require 3 sets of vitals or they require this and that based on providing support, that would be up to each state.
I think it should remain the same.
Yeah, Mark made a really good point, and then because they may not have the same vendor and things like that. So in that case, it would make sense to keep it the same and let the states delineate what rules they have surrounding support roles.
I'll look through the list of participants really quick and see if the agency that made the original request is on, and if they have any additional questions.
And if I can offer a perspective from Houston, I think we have a recent a case that maybe speaks to this a little bit, which is so during one of our many disaster weather events that we love to have here in Houston, we had a state task force come by and provide additional EMS coverage in our in our territory for one of the periods of the hurricane. And we ran into a problem down the line where it was something we hadn't considered, which was that we had agencies that were basically providing EMS mutual aid in our territory that we may have had our crews were the initial provided care, and then it was handed off care to to this other agency. Then down the line, we have patients that are requesting their records, which we literally don't have that information because it was another agency's record. And so we have to say, well, you're going to need to contact you're going to need to contact that agency directly. And in some cases, we didn't even have very clear idea of which agency it was of the 15 that we had that were providing patient care. So, I mean, I think in that case, we might have saved ourselves a little bit of grief if we had some basic like a minimum of demographic information. Even if our crews had only been with that patient for a few minutes, it would have helped us tremendously to say, at least try to get that information before you hand off care to this other agency. Normally, we don't think about that because we typically are doing everything in-house, where if one crew doesn't get the demographic information, then another one of our crews will get that demographic information, so we don't have a problem with it. But in this situation, which was a new situation, we were not accustomed to operating in that way, and we were not able to provide the level of service that we would like to provide. And we only realized it after the fact.
Thanks, Sundown. Yeah, that's another good point, right? And that kind of lends itself to what if it's another agency and what if it's another vendor, right? How do you find that information? Are there any other state data managers that wanted to comment on this or think differently or anything like that? So I will get back to the agency. I did not see the person who initiated the request, but there may be some of the agencies on the call that also had these questions. I will get back to the initial requester. It sounds like the argument is just to keep it the same for now, that not to consider, and then leave it up to the states to determine what the other requirements are when patient contact is made state to state, which is currently how it's done. Thank you, everyone, for commenting and taking part in the discussion. This is exactly what we're hoping for when we talk about the schematron rules. And just putting it out there, if you have a rule that you want this group to discuss, that you would like to have considered either for adjustment, or you're just thinking, hey, I need to hear how other people are thinking, how it's affecting other people, please feel free to send an email or actually open up a help desk ticket so we can track it on the help desk system. And we'll talk about it on the call. Monet, thank you.
Thank you so much, Jen. That was absolutely beautiful. And that's exactly what we're looking for, is that type of conversation. I just love hearing all your voices and your opinions on various topics. So thank you so much for that. All right. It is now my turn to share the topic that I'm sure you're all happy to hear about. So I am happy to share that the NEMSIS annual meeting registration is now open. And what we'll do is just go ahead and click on the Save the Date banner, which will take us to much of the information that is now available for you all. I want to let you know that the first thing is on behalf of the NEMSIS TAC team, I'm inviting every one of you, all 119 of you on the call, to attend this important meeting in Park City, Utah from August 26th through the 29th. And I want to also mention that the University of Utah's finance system has turned to a new online e-commerce system. And so when we click on this registration tab here, everything is going to look different than what you're used to seeing in past years. Now, it has the same great functionality and it has some improved functionality, but this new system will ask you to register so that you can pay by check or pay by ACH payment, which we would really appreciate. This meeting, the theme for the meeting is robust communications and collaboration. And for the full day conference, or for the full conference, it's only the $500. That will be Tuesday through Friday. And we're offering this early bird price up until June the 28th. If you have any questions about anything related to the annual meeting, you can certainly submit a help desk ticket right here on this page, and it'll get to us and we'll be able to respond to those questions. I want to just remind you that in-person attendance is the best experience. Certainly, we try to do our best to offer some virtual streaming, but there's nothing like that one-on-one. You get to see people face-to-face who you haven't seen for some time, get your hugs, get your comments. It's a great time. So we look forward to seeing you. I want to let you know that the in-person registration here, there is a zero price point as it shows on that screen but I want to let you know that we're offering two options here. If you decide to come Tuesday through Friday, it's the $500 price point. If you're only attending for the two general sessions, it's the $450. So you can see that attending for the 500 or the Tuesday through Friday is your best price point. The other thing I want to mention is that if you register and check out, that's fine. But if you want to register additional people, this is the tab that you will use. And then also registering allows again for the payment of the ACH check. And we're asking that because we've moved away from the option of people sending checks in the mail. It takes us several months to find those checks and to reconcile all of our accounting issues. Now, this virtual session here, this is actually just the virtual session for the EPCR agency. And so if you're not an EPCR agency, we would appreciate if you do not sign up for this option. And if you are a state data manager, we do have an option for you as well for the virtual streaming. And this will be for the all-day Tuesday pre-conference forums, both of these options. I will take a pause and just see if there are any questions about this registration portal.
Hey, Monet, there is a question in the chat from Steve Laporta. The website says the early bird special pricing is until July 28th. Can we confirm if it is June or July 28th? Thank you.
Yes, it's July the 28th, and we'll get that fixed. We appreciate. Thank you for bringing that up. Okay. I am also going to go back to the website here.
And Monet, can I clarify one thing? I think you stated this, but the virtual option is only for Tuesday for the pre-conference. So the general sessions, Wednesday and Thursday, there will not be a virtual option, but it will be recorded and posted afterwards.
That is correct. Thank you so much.
Yep.
Okay. On our webpage, on the homepage of, sorry, not the homepage, but the annual meeting page, we also have some documents ready for you to submit to your managers or directors to request approval. So we know for a fact that you need an agenda. And so currently we have a draft agenda available for you, and you can take a look at that. We also have a letter, an invitation letter. And so we're asking that you would utilize the letter and the agenda to start your process to request permission to attend the meeting. In addition to that, we're doing something new this year. We're going to introduce something called lightning rounds. Now, many of you, I'm sure, have participated in lightning rounds or heard of lightning rounds. If you participate in Toastmasters, you may have some experience with this already. This is basically an opportunity for us to hear from you. Oftentimes, the annual meeting is structured in a way where NEMSIS tax staff, our sponsored guests are the presenters. But we also want to hear your ideas and things that you want to discuss. I know there's some people on the call now who've been at the meeting or been involved in NEMSIS for over 18 years. And you know who you are. So I'm asking if you would consider being a lightning round speaker. This is just an opportunity for you to speak for 5 to 10 minutes to talk on a subject of interest to you and interest to the general EMS community. And what we would like to do, the purpose of this is to increase engagement. We heard from your comments on the 2024 evaluations that you wanted more engagement. You wanted opportunities to talk to each other. You didn't want to just hear from us. So we're asking that you would consider utilizing this time. I'm going to go ahead and click on this letter so you can see that we would love for you to, participate, and then we will review the applications and make some decisions. We're giving you until June 30th to submit this form. Here's a QR code that you can go ahead and take a picture of. and then just start submitting those things. Even if you're not sure of the topic, or I mean, we want you to be sure of your topic, but please consider this because I think this would be really fun. It's going to be new. You know us at the TAC, we love introducing new things, having great, I call them Goonie adventures, but this will be a great opportunity. And then last but not least, we have a document on the website that describes the payment and refund process. We do understand that certain things come up and that you need to request refunds, and we're giving you plenty of time to make that happen. So just review this document for clarification on what that policy looks like, especially as it relates to the new e-commerce system that we have available. Now, I also want to mention that we have a brief or an opportunity to provide some limited funding to state managers who may have some difficulty participating. We call these scholarship opportunities. And we did send out an email on March 11th. We will be asking for you to submit those applications to us by April the 16th. Assistance will be provided on a first come, first served basis, and we will try to accommodate as many people as we can. But again, the funding is limited, so please don't delay. We need those applications as soon as possible so we can make some decisions. All right, I would love to see if there are any questions at this time. All right, if you have questions that come up later, please send us a text or email. Actually, submit it in the help desk. The help desk can be found on the bottom of every page on the NEMSIS website. And you just click that box and then you would submit the ticket to the appropriate, based on the topic. This would be a general request for help. All right. And I don't see Mr. Chaney on the call at this time or anyone from NHTSA. Would my team help me confirm that that's true?
I checked as well, Monet. I didn't find either of those folks on the call.
Okay. All right. Well, I would also like to mention that we are having a public training scheduled for Tuesday, April the 1st. And the topic is NEMSIS efforts to support mobile integrated healthcare and community paramedicine documentation. Dr. Mann will speak on this topic, as well as Kevin. Let's see, is Kevin on the call? Our director, Kevin, and Ms. Jen Correa will also speak on this topic. And so we would love for you to participate in this particular training. We will get a notice and a flyer sent out this week, so just look out for that. And then I would also like to mention at this time that we will be doing our breakout session. So let me just change my screen for just a moment so you can see those breakouts.
Hey, Monet, while you're doing that, can we just do an open call for any?
Yes, thank you so much. Yes, open forum. Are there any topics of interest to anyone on the call at this time?
One thing I wanted to bring up just briefly, Monet, we've heard from 2 states, Utah and Georgia, who are participating with the drug company, looking at participating in a randomized trial for pain control in the pre-hospital setting. And those 2 states have reached out to us, and we've reached out to them to talk about how perhaps NEMSIS can support clinical trials. This one is specific to medication, but they could be specific to procedures as well, their protocols. We're very supportive, of course, of using the custom elements section within NEMSIS to devise kind of elements that could help companies test new medications or new procedures in the pre-hospital setting. That's just fantastic that we have the opportunity to try to improve the care we provide using this research method. So we're going to continue to see if we can flush out some, quote, national elements that may help support research, randomized trials in the pre-hospital setting. I just wanted to ask if there are any other states or any other vendors who know they have agencies within their jurisdiction or using their product that is participating in this trial. Okay, great. We'll continue to work with Utah and with Georgia, gathering the information that would help us see if we can provide some standardized custom elements for research. Thank you.
Hey Clay, it's Felicia.
Yeah.
Sorry,
yeah.
my voice is scratchy.
Oh yeah, please.
I gave Jen a list of other states that were involved in this or the project that our state's involved in. So she has a whole bunch of other state names. So maybe they haven't told their data managers.
Oh, great. Okay. Yeah.
Because there was about 8, I think, different states that possibly could be involved.
Oh, good. And Lori, I just listed the link to the trial.
Yeah, thank you.
Yeah, and in that link, if you scroll down a little bit, it says where this study is being done. So there are, it looks like maybe 12 or 15 trauma centers in several states. So if you haven't heard about it yet, there might be agencies wishing to participate along with these hospitals.
Thank you, Lori.
Yeah.
And there are still some facilities that are trying to get into this study as well. I know Georgia has a facility that's trying to actually become a participating facility. So if you hear that your hospitals are trying to become a facility, let us know.
Hey, Jen, it's Mark. I just noticed we've got 2 on there for us as well. So anything that we need to do, let us know, please.
Thank you, Mark.
Okay, is there anything else? We have plenty of time. Anyone has anything else they want to bring up? Okay, then we will have a very short call today, which is okay because we're all busy. So first of all, I want to thank you all for participating today because we know that you're extremely busy and we do appreciate you taking time out of your busy schedules. But before you leave, we are going to jump into these vendor breakout rooms today. And we have Alabama, Biospatial, ESO, Image Trend, Ohio, and Texas today. Now, the rules are simple. Please just respect the fact that each person wants to speak to their direct customers. And so we're just asking for that level of respect and courtesy. And so now we'll just go ahead and jump into the breakout rooms. And stay on if you have some trouble getting into the breakout rooms. We'll give you a little bit more instructions on how to do that. And for everyone else, have a great rest of your day. Have a fantastic spring day and a great weekend.